Hi there, and welcome everyone to our Tuesdays at 10 with Marty and Jen. I am Marty Winkler, if we have not met, and I am the president and CEO of indigomartini.com, which is my business that includes emotion code, body code work, which we're going to talk about a little bit later in the show. Also, LifeWave brand partner, using the patches, essential oils, and other amazing lifestyle things. So, welcome to our show today. And first up, I am going to read the disclaimer that you see here at the bottom of the screen that what we're sharing today is for informational purposes only. It is not intended to prevent, diagnose, treat, or cure any disease or health issue that you may be experiencing. If you have health questions or concerns, please contact your healthcare provider. And with that, we are ready to get started here today. Jen, are you ready to do our overview of X39 and then go into our topic of pain management? And this is actually going to be really interesting, guys, because Jen's going to give us some great information on why pain is not always a bad thing, right? Okay, Jen, so let's go and get us started.
All right. Hello, everybody. So I'm Jen Jordan. I have Nurse Jen Jordan Health and Wellness Company under the umbrella of Sovereign Spirit Ministry. And what I do is get to the bottom of people's ongoing or acute health issues really within the first hour that we're on the call. So it's very cool. And so today we are going to be talking about LifeWave X39 patches, even though this company LifeWave has 11 patches in their lineup since about 20 years ago. The first patches, energy enhancer patches, were created by David Schmidt, the owner, CEO, inventor, brilliant man behind this company. And he was commissioned to start to create a product that would keep our Navy SEALs up for their 3-4 day missions without having to use methamphetamines or caffeine. So he developed the energy enhancer patch, and that's where this all started. Then he continued to do research over the years, at Stanford University and all over the place. And the patch that came around in 2018, it was the X39, is the X39 patch. Why is this one so special, and why do we feature this one every single week here? And that is because it is the master stem cell patch. So what does that mean? This patch, when it's applied to the body, stimulates in our own body the production of what's called GHKU copper peptide. What does that mean? Most people start looking at me like, what is happening here? Well, GHKU copper peptide is very well known in the literature to stimulate the production of our body's own stem cells. Okay, stem cells are a big buzzword these days because they are actually what heal the body. Okay, it's sad, but we could talk a little bit about it. But some people end up having to travel out of the country because they're illegal here to have these injections done. But I'll talk about those in a second. But this is the alternative to stem cell injection therapy. And what does this patch do? How does it work? Here it is. So actually, I'm going to use this one. This is a different patch. This is actually glutathione patch, but I want to show you it works the same way how we apply it. So inside of this little band-aid looking thing, we have a crystalline amino acid structure in here. When my own light from my body, my own infrared light that my body creates, that your bodies create, because that's how we see people at night with night vision goggles, because we are light beings. We're always emitting light. So when my light hits this, due to the specific pattern that's in here, it refracts back into my body, messaging my body to make GHKU copper peptide, which then my very intelligent body and your very intelligent bodies know, ooh, when we have more of that, we make stem cells. Okay. Now, some people think, well, that's a very strange concept. You know, how could something from light tell our body to do something? Well, think about how we make vitamin D. We make vitamin D from light. So when the light comes in and hits our skin and moves through it, it refracts a certain pattern that tells our intelligent body, hey, make vitamin D. okay, which is extremely critical for life to have vitamin D. Otherwise, we wouldn't make it. So it's not a strange concept, except for this man's so brilliant. He was able to harness this into patches to tell our body to do these processes. So that is how it increases GHK peptide, which is then how we increase our stem cells. Okay, so why do we even care about stem cells? What's the big deal about stem cells? Why is it such a buzzword right now? Because this is what heals and repairs and grows the body. So when we come together, we have egg and sperm come together at conception. Boom, wow, there's a crazy amount of stem cells. How do you think we grow a head and arms and organs and all of that? That's stem cell. Okay, so then we're born, and birth to 1 year is that incredible exponential rate of growth. How is that happening? Crazy amount of stem cells that kid has. And what happens when those little kids fall down when they're learning to walk, right? And boom, get back up. They're fine. What happens if we did that now? Ooh, yeah, not so much. Why do they bounce more than we do? Well, because they have an abundant amount of stem cells. And I'm going to share with you here the problem with this. As we age, as we get older, we don't have the amount of stem cells as we had when we first started out with this amazing life. So if you look here, and I don't have the numbers in here, but I have it on the next slide. Here we have, newborn. So boom, like I just talked about, a massive amount of stem cells. And then they start to fall from a year to 12 years old. And as we cruise up here, you can see this massive decline. So what I want to create in your mind here in this visual, you guys, it right here is what aging is. Okay, aging isn't inevitable. Okay, aging is just a reflection of our declining stem cell numbers in our body. So let's look at this other slide here that gives a different kind of a visual. And so at age 20, we have 1 billion healthy stem cells. Okay, 20s, yeah, we're all rocking it in our 20s for sure. And we think we're immortal. And then by the time we're 60, only 40 years later, they've declined by 90%. Does that explain something to you all?
Jen, your slide's not showing.
Oh, interesting. Okay, it says
So stop this one and then start the other one.
Thank you.
Welcome.
Let's go back and try that again. Okay, tell me, how about now, guys?
Wait for it to load. There we go.
Okay. Y'all, what are you talking about, Jen? Okay, so this is a fantastic visual. The other one gives that slide, that decline where you can see the process of aging, which again, is just a function of decreasing stem cells. And just to reference back here, at age 20, we have 1 billion healthy stem cells. And by 60, we've declined to 90%, to 100 million. Okay, by 80, we've declined by 95%. Okay, so, look around. What's happening to most 80-year-olds that are not aware of this amazing technology? Now, this can be a very good visual for people because all this is showing the difference, in the aging process, decreased stem cells. Okay, when we lose collagen, which is something we have less stem cells, we are also having less collagen. That's where we start to get these wrinkles, as we lose our infrastructure in our body. And the X39 patch not only helps us increase stem cells, but it increases collagen, which we have a great show that we did about collagen at one point. And collagen creates all the infrastructure for everything to build around. Collagen is our scaffolding. So as you can see here, as we get older, our scaffolding starts to break down. And then, so this facial representation here is basically a visual to give you something to know what's going on the inside of your body. So it's like this on the outside, then it's like that on the inside. So we're talking about our bones and our organs. And did I stop sharing that, Marty?
Yep, you're good.
This is my IT bloop of the day. Okay, so basically, so the issue here is that we have declining stem cells. That's the problem. And then what follows that? Well, we have breakdown in our bones, our joints, our organs, our gut, our eyes, everything. And that's what X39 is covering. And I want to speak to stem cell injections because a lot of people are talking about them now, because what that means is they're taking other people's stem cells. Okay. And we won't go into the nastiness of where those can actually come from. Maybe that could be a whole nother show sometime. And then they are injecting them right into the area where is needing repair. Typically it's a spine or bone marrow or, or a knee joint. Okay. In an effort to avoid a replacement surgery, something like that. Can they be effective? They can. There's a 30% efficacy rate, so it means 70% of the time that's failing. And the issues with it is they are not allowed in our country, so people have to spend an exorbitant amount of money to travel outside of this country to have it done. And it is very expensive, anywhere from $5,000 to $60,000 or more, for depending on the level of treatment that's needed. And what it's not doing is stimulating the body's own mechanism of creating more stem cells. Why is that important? Because if we don't address the original problem that got that person to that level of pain, to that level of deterioration, then it's going to just return. Okay. And that's why it has a lower rate that way. And these are very invasive procedures. There's high risk of rejection, of actually setting the body up more into an autoimmune state, because if there's already a great deal of inflammation in the body, that could be what tips the scale for that person. And I did mention the risk of infection. So this is a great alternative to this. People are catching on to this because I did see something recently, a pretty reputable company making a GHKU liposomal, which I can explain another time why that really won't work for most people, but they're catching on. They're realizing, wow, if we get this GHKU copper peptides up, then we're going to make more stem cells. Okay. David Schmidt, light years ahead of everything, always. So he's already on to this. Okay. So I want to just tell you, when you put an X39 patch on the body, within the first few days, 3,000 to 4,000 genes begin to reset. Why is that important? Because we have been told, many of us have been told, that you're stuck with your genes, bad, good, ugly, whatever they are. That's your sentence. That is not true. 99% of our genes are actually, we can influence them. We can upregulate them or downregulate them. So if there's genes, if there's cancer genes out there, we can actually turn them on with environmental environmental factors, toxins, chemicals, all the things. Or we can, we can actually have them express in a protective way by doing something like increasing our stem cells in our body. Okay, so we can play with this. So 3,000 to 4,000 genes within a few days start to get influenced by this. Within about a month, we like to think about these stem cells that are building and building and building in our body as our army coming on board. We're building the troops. We're calling them in. Now, at about that 1 month mark, they're all lined up, ready to go. Okay, just point the way. Do we need to go to the brain and start working there? Do we need to go to that left knee that might be injured? The back, whatever it is. The pancreas? Do we have, a diagnosis that's affecting the pancreas that can start going to work on? Absolutely. Why is that the case? Because stem cells are what are called pluripotent cells. They go anywhere in the body. They know exactly where to go. They're your helper. Okay. They're your rebuilder. And they continue to multiply and duplicate and wake up the longer that we have these patches on. Okay, this part's very cool for so many people. At around the 6 week mark is when the brain starts to come into balance. Okay, so here's the thing. We are humans living on Earth. Okay, it is not an easy place to be. We're constantly bombarded with stress from birth. Background's labor and delivery nurse. I see these stressed kids. Okay, so we need to balance our brains. If we don't have a balanced brain, we do not have a balanced body. Okay, Marty's going to be speaking a little bit more as we move forward about how emotions are actually a lot of the times the root cause of pain. So this starts addressing that. So within 6 weeks, we start to see less anxiety, depression, brain fog. Why'd I walk into the room? Okay, that all starts to go away for people. Within 3 months is when those collagen, soldiers start to show up too and start to rebuild that scaffolding inside the body. That's when you might start to notice some changes in the skin, hair, or other people around you will say like, hey, something's looking a little different. What is it? You're a little glowier. That's the collagen coming on board. And then within 6 months, and this is really important for a lot of people right now, that is when the whole cardiovascular system starts to rebuild and become replenished, because every 6 weeks that this patch is on the body, the cardiovascular system goes back in age and repairs by 8 weeks. So this is cumulative. So, we're looking at 6 weeks, 8 weeks of and reverse aging of that cardiovascular system, another 6 weeks. Now we're looking at 16 weeks, right, of reverse aging. This has been something that reversed an arrhythmia that I developed after having COVID horribly, and also some, another heart issue. So that has been resolved. Okay, and then right around the 12-month mark is when we're really starting to just really come in and feel better, and those aches and pains we notice are gone, or I don't need to wear that brace anymore. Or, wow, my scar tissue is really turning around in my body here. And what we recommend, if someone's coming on board here and they're just thinking, I'm curious about these. I wouldn't mind having more energy, because that's one thing I didn't mention. The amount of energy these produce or help your body produce is off the charts. It's amazing. But I'd like to have more energy. I'd like my skin to be better. I'm a little bit achy in my joints. Maybe that would be a nice little improvement for me. We're looking at about a month per every decade of age you are. So when I came on board with these a couple of years ago, I was in my early 50s and I thought, okay, I'll try them for 5 months. So now I'm at almost the 2-year mark. Okay, so that's what we recommend. If people are always wondering, well, how long do I have to use these? Because it's not a quick fix, one and done. Okay, there's nothing in these. These are non-transdermal. These are helping your body heal with light. So we're not putting a med in here that's going and putting a Band-Aid on something, which people are so accustomed to in this culture. So if we have a diagnosis of some kind, then we're going to be looking a minimum of 12 months, 12 to 18 months. What we have seen, looking at people's stories around the world, 82 countries utilize this technology. And what we have seen is sometimes that person's switch over miracle, whatever that is at month 15 or 16. So what if they stopped at a year and they didn't get there? We cannot know how much damage has happened inside of our body. Only our body knows that. So we can only watch from the outside, or we get labs back that are showing us that we're doing some major accomplishments of healing, with a level of inflammation. That's another thing we can talk about another time too, is how do we measure this? What kind of biomarkers can we look at? Okay, the other critical piece of this is that we're staying hydrated, because our cells need to have good hydration in order to this function to occur. We like to recommend using Celtic sea salt. I really like the brand Eden. And take a few crystals, put it on your tongue, drink about 5 to 6 ounces of water about every 30 minutes throughout the day. You don't necessarily have to do the salt every time, but several times a day, because then we're actually hydrating our cells over time throughout the day. If you just gulp, down a liter of water, only about 5 or 6 ounces is going to get pushed into the cells anyway, and it's just going to go out in the plumbing. Okay, so that's a really critical way to drink, and you'll start to notice that you'll have a little more energy when you start hydrating in that way. Okay, Marty, anything that I missed on that before I start talking about pain?
So how often do you wear the patches? Do you wear them every day, or what do you do?
Yes. So what you're going to do is you're going to wear them for 12 hours on and 12 hours off. So for example, if someone gets up at 8 o'clock in the morning, they can pop them on at 8 and then they can take them off at 8 o'clock, that evening. It doesn't matter. It can be 11 to 11, 9 to 9. And what the whole point of that is that we want to ask for 12 hours. Come on, let's get some GHQ copper peptide in there. And that GHQ copper peptide is going to be like, come on, stem cells, let's go. But what we need to do is we need that 12 hours off to rest, right? So our body's being asked to work, and then it needs a break, just like us, right? We are our cells, right? So our cells need that time off too. We know that we need that break. And so what happens if you forget and leave it on for 24 hours? Well, we will refer you to a surgeon to have your second head removed the following week, and you'll be fine. No, that's kidding. So everything will be fine. You will not start growing extra body parts. You just leave it off for another 24 hours and then start again that day. And what's the reason for that? That's because we don't want the body to start getting into what's called an attenuation process, where it just gets too used to this like nag, and the body starts to go, I'm just kind of getting used to you, and I'm not going to actually make this GHQ copper peptide to help me make more stem cells. So that's why we have that break. Okay. All right. Thanks, Marty, for that reminder of actually how to use them.
Sure thing. Yeah, I think we're good to move on to our topic of pain.
Okay. So hop over here. So how we're going to address this today is not that way. Has anyone here ever thought about why we have pain? Because it's something we just know about. Oh, that hurts, or this hurts, or but we've thought about why that it actually could be a good thing. Okay, see, I'm here. I'm always the one here, like defending the underdog. A couple weeks ago, right? I was defending cortisol. Right. So we're gonna do this here with some pain. Now, pain has a purpose. Okay. So what it does. So when we experience pain, this alerts the body to a potential, or an actual harm. Okay. So wow, I actually touched this hot stove. And I need to know that would be a really bad idea if I kept my finger on that stove. So this actually supports protective actions to prevent further injury. Okay. And it also helps there because it guides the healing process by encouraging us. Isn't that a nice way of saying that you hurt so darn much you can't get up? Okay. So it encourages us to rest, so we don't continue to further damage that part of our body where we're getting some messaging from. And it also helps with learning and memory to avoid any future harm. Let's think about going back and touching that stove. Okay, we now know that was a really bad idea and I won't do that again. Okay, so how does that even work? How does it know? What we have, I just went over this. We don't really need to go over that again. Okay. So say when we touch that stove or we overextend our knee or twist an ankle, whatever that happens, we have something called nociceptors. They're everywhere. They're on the ends of our fingers. They're on all of our skin. They're on our muscles. They're in our joints. And what those receptors are is they're the little guys out there saying, monitoring when something gets bumped too hard and it hurts. So this can be either thermal, like I talked about with the hot stove. This can be chemical, a chemical burn. This can be mechanical. Ow, I just ran into a curb and I stubbed my toe. Okay. When that happens, that nociceptor says, oh, I'm right here and I'm on it. And it signals a transmission straight into the spinal cord through those nerve pathways. Okay. And then what that does is it goes through the spinal cord and relays to the brain, where it's going to actually hit the thalamus rather. Once it hits the thalamus, which is part of the old brainstem, okay, and here is that now it's going to relay sensory signals to the appropriate brain areas. And then once it hits a certain part, because it's somatosensory cortex, this is going to identify the pain location and intensity. So think about it. Think about if you stub your toe. This process is so fast because how soon do you know you stubbed your toe? Because it hurts like this, right? Isn't that wild how fast that travels through that system? But it also identifies the intensity. It's going to let you know how much it hurts. And I always, I think this is funny because we talk about some people like, oh my God, you're such a baby, you know, like, wow, like one person can stub their toe and just be like, all right, I'm going to keep walking. Another person like needs to call 911 and go to the hospital. That might be gender specific too. Anyhow, we won't go there. So that's basically your experience in telling you where it is, how much does it hurt. That's the pain modulation. So it's the nervous system is going to regulate how much pain you feel, how much pain you actually feel. So check it out. You might stub your toe with the same amount of intensity. The amount of pain you feel is going to be influenced by the level of stress you're experiencing. If you've had enough sleep the night before, the memory of pain, okay, nutrition, okay, and mindfulness. Mindfulness meaning like, this is probably really bad. I'm just going to start breathing right now, and I'm going to decrease the level of pain I'm having experiencing that. Now, let's look at nutrition. Why in the world would this make pain worse for some people? Okay, so if you have achy joints, okay, because we're talking about it, we have acute and chronic pain, and you have a known gluten sensitivity, you are going to have achier joints, and you're going to experience, your brain's going to tell you there's more pain because you have that sensitivity than the person over here that has achy joints and doesn't have a gluten sensitivity. Okay, I just want to throw that in there. And it's not just gluten. And then we have two types of pain. We have the kind right now. I just burned my finger. I just, stubbed my toe. And that's typically related to injury or illness. And this is going to resolve with healing. You're going to heal. You're going to heal way faster with an X39 patch. It's bizarre. And this is, again, serving that protective purpose. Now, chronic pain, so does anyone actually know a chronic pain, how it's defined? This is pain that goes way beyond the normal healing time, and you're still experiencing pain 3 months later after the onset. That's what's defined as chronic pain. This is what's often also involves what's called central sensitization, and that means that the brain and spinal cord become really edgy and hypersensitive. And what this can happen is it can make the pain worse or exaggerate the pain more than what it's actually signaling. Okay, and I'm sure people have experienced this. And this chronic pain can also exist without any ongoing tissue damage. So the damage is done. We've done it, but now the brain is actually caught up on this and it's keeping us in this pain state. And Marty's gonna lead into this now as to why that can happen. Is this a good place for you, Marty, to hop in?
Sure.
Are there any questions here and that anyone has?
I don't see anything in chat.
Okay.
So we can just, let's just keep moving on. And I'm going to share my screen. So what we're going to talk about now, we're going to transition to how do you manage this pain? All right, is this it? Yes, there we go. So pain management, and we're going to talk about a couple of different modalities. And first up, of course, is with the patches. And like Jen mentioned, there's acute and chronic pain. So specifically what we're talking about first is acute pain here. So what is suggested is X39 and Aeon for cellular repair and addressing the inflammation portion of the pain. So those two are kind of a given, and those are like the dynamic duo. However, let's say you hurt something, you wrenched your back, you tripped and fell, and you have, something's really sore and really hurts. That's where IceWave can come in, and it's designed for immediate pain relief. IceWave is a dual patch system, which means there's a tan patch and a white patch. So tan always goes on the left, white always goes on the right. And you'll see a little bit more about that as we move through the presentation here. And what IceWave does is it balances the energetic flow and reduces the pain signals. This is not one of the patches that induces repair. It just shuts the signals off, the pain signals off. So the other patches and can stimulate your body to do the repair at the deeper cellular level. And IceWave can actually be used up to 24 to 48 hours if necessary. We've had experiences with people getting relief after 30 years of chronic pain. So this one woman, she's like, I'm not taking these off. This is the first time I have felt no pain in almost 30 years. So of course, eventually you do have to switch them out, right? But what's recommended by Dr. Jen O'Sullivan in the patch manual is 5 days on of use of IceWave and then a day or two off again, so your body doesn't get used to it. And I know some people are like, no, I don't want to take it off because I'm finally pain-free. But listen to your body and do the right thing to help with long-term pain management and actually repair of whatever's causing the issue. Okay, now I wanted to include here, excuse me, a couple of ways to use IceWave. And if you know how to muscle test, we strongly suggest that you use that. That's what I do when I'm using it. I should have my patches out here, but like, for example, if I'm putting IceWave on my husband on his back, start with the tan patch, right? You do the tan patch first, and then the white patch is opposite of that. So let me just go in order here. So X39 on GV14, which that is your neck bump, right? So most people that are using IceWave are going to be using X39 anyway. So you have that on. One of the suggestions by Dr. Jen O'Sullivan is tan on the bottom of your left foot at K1, and that's just a little bit below the ball of the foot toward the center of your foot. So check the diagrams that come with IceWave or in the patch manual. So tan on the left foot, white on the right foot. That's a great way for overall pain management throughout the body. Okay. Next is what's called the clock method. And there's a couple of them here. The first one that she suggests, if you can put the tan right on the pain, and then the white one, you're going to start at like 2 inches above wherever the tan patch is and hold it there. You don't have to peel the sticky part off, just hold it there and wait and see if pain is reduced by 80%. So that's a big statement, but once you start trying this, you're going to see people are going to get results really quickly with, positioning these in the correct spot. Okay, so let's say you've got your tan patch on, 12 o'clock is your white patch of 2 inches above, still not feeling anything, pain is still there. Okay, start moving it around the clock, go to 3 o'clock, see if you get results. Then if not, go to 6 o'clock and then 9 o'clock. So just keep moving it in a circle around until you feel the relief, because what it's doing is signaling the nerves that are involved in the pain in that area. Okay, so that's one way to do the clock method. The second way, and we learned this from Lillian Walker when she was visiting here with us a few months ago, putting X39 right on the pain, like Jen says, X marks the spot. So you put X39 right on the worst pain. Aeon, again, about 2 inches above or below it. And if you can muscle test, it's going to help take some of the guesswork out of it, right? And then you're going to use the tan patch 2 to 3 inches to the left of X39, and it can be up or down. Okay, so it might be a diagonal type placement, right? Not, exactly horizontal apart from it. So play with that, and then wherever you put the tan patch, the right is going to be on the opposite side of the X39 there. Okay, so that's clock method number 2. Another way, which I have not tried this yet, but she calls it bracketing pain. So let's say you have, a pain on your back or lower back, tan patch right on the pain, and then you put the white patch on the opposite side of your body. So it's like working through your body, right? Another example of this was a headache. So again, tan on your left temple and the white patch on the right temple. And we had an experience with Amy at one of our events a few months back where she had a really bad toothache. So we put the X39 on the toothache, and then we just kind of tested it. We put like a tan right behind it, And then on the opposite side of her head, we put the right. And literally within 30 seconds, she's like, the pain is gone. It's been bugging me for days. So these patches are really powerful if you learn how to follow the directions and or get creative. And I strongly encourage you to do muscle testing to dial it in, especially with the IceWave. Okay, let's move on. Now we're going to talk about pain management with doTERRA essential oils. And you might want to take a picture of this. This is a lot of information. I'm not going to go through all of this, but there are several different types of oils that have different properties that help relieve pain. And you see I have physical pain in here. Emotional pain is another part of this as well. And if you're not aware of it, every one of the oils, the essential oils, has a physical side to it and an emotional side to it. So you may not even be working on the emotional side, but your body is going to benefit from that part as well. How am I trying to say this? For example, anger originates in the liver. And if you're having issues with your liver, there is an oil blend that's called Forgive that goes over your liver. And that is going to help with the physical and the emotional aspects of what your liver needs and helping clear the emotional attachment to anger in this case. Okay, so, but you can see through on this slide, there's all different kinds of physical pain that I put some of the best recommendations in here for relief. No, you don't need all of these, but if you happen to have one or two of these oils that can help with whatever type of pain you need relief from, there you go. Okay. All right, next. So we thought we'd cover some lifestyle tips for pain management as well. And we touch on this pretty much every time we do one of these Zooms because your lifestyle contributes greatly to your overall health and wellness. So moving your body, walking, stretching, playing, doing something to get your body moving, depending on your age, your ability, if you have any injury that you're recovering from. But just the more you can move your body, you're getting the fluids going so your body can help take out the trash, take out the toxins through your lymphatic system, which we're going to be covering next week again. Long story. Anyway, get your body moving. 7 to 8 hours of restful sleep every night, if possible. We do have patches that help with that, oils that help with that as well. Getting physically grounded to the earth, and that means bare feet on grass, dirt, a beach, wet concrete. If you can't be out in nature and you have a little patio, wet it down. Wet concrete will help ground you. Get your bare feet on that. Hug a tree, walk in nature. Touching plants and trees is super grounding. Also, pets. If you have, a dog or a cat, they go outside and they are always grounded because their feet are always touching dirt and ground. So they are very calming and grounding. So that's another great way for you to get grounded when you're petting your pets, right? They love it. It's calming and soothing to you, and it's helping you be grounded. Clean food and water and an environment. Clear the clutter, if possible, in your house, in your living area, in your land, yard. It's going to help calm you down, and then that also ties in with pain management. Limit Wi-Fi and EMF exposure. That's everywhere. We have, everybody's on the internet or on their phone constantly. So try to limit exposure, get things that can help block some of that EMF because that just triggers inflammation and pain. Another super important thing is manage your self-talk, especially if you're dealing with chronic pain. Listen to what you're saying. If you're like, oh, everything hurts all the time, I'm always sick, I'm never going to get better. Your body is listening to this. Your brain is always listening, whether it's true or not. And you may just be complaining or whining. Your body's like, oh yeah, you're right. I am always in pain. I am always sick. So your body's going to make sure that that condition exists and keeps perpetuating it moving forward. So Instead, I would suggest catch yourself saying something negative about how you feel or about your health and switch it to saying, I'm getting better every day. I'm feeling a little bit better every day. Whether it's true or not, your brain is going to believe it and your body's going to start acting on that. Okay, manage what you take in, not just food, but what you watch, listen to, and read. And I love to say this, avoid the news. I can't watch the news. It drives me insane. And another thing, if you're watching like regular TV, in between the news stories are commercials for mostly drugs. And that is one thing that is personally bothers me a lot. So I've trained my husband to mute those commercials, right? In between shows. So I would encourage you to look for things that are upbuilding, nonviolent, and non-fear based, because that just aggravates pain. Excuse me for a second. I got to get some water. All right. Listen to healing music. There are some frequencies that are called solfeggio frequencies, and there's several of them. 174 hertz specifically removes pain, and you can go to YouTube and search that for free and just give it a try. Listen to it. Put it on in the background if you're working or resting. That's a great way to, for your brain's paying attention, and it's going to help with the frequency on that. Your job, I shouldn't say job, but something that would be really helpful is for you to raise your frequency and your vibration, right? And this calming, soothing music helps turn down the pain vibration receptors and helps you uplift and get past it and through it, so it's not as bad. But it's going to take a little time, but why not give that a try? Next, connecting with supportive friends, family, if you have them. If not, pets. There you go. But again, people that you associate with on videos and TV shows, make sure that it's uplifting and not bringing you down. Of course, deep breathing, meditation, and prayer, that all helps change your state, as does smiling. If you're sitting in a chair and everything's hurting and aching, like Tony Robbins likes to say, stand up, move your body, change your state, change your physiology. That's going to help move the pain through as well. And what I thought was super interesting is all of these things also help you with emotional pain. Okay, now moving on to emotional pain here. Jen, let me check real quick. Is there anything that you want to add to this? Or I'm not looking at the comments.
I'm watching the comments for good there. And I would like to discuss, well, we're right here, and it's something we could just talk about for days. But two things here. So pain and disease can often become someone's story before they even, and they don't even know it. They don't know it's their story. So I think that, talking about, one of my slides is talking about mindfulness, and like you're talking about, becoming more mindful around, disease or pain. Disease is emotionally painful, right? If you have a chronic disease. So really reframing the words, just like Marty said, and listen to your self-talk around pain or around disease or on something chronic, because you start to actually own it over time. So I encourage you all, or anyone that's working with other people, to really ask themselves to check into their self-talk around their pain, around their disease, whatever it is, and try to make sure they're not creating this story. Like, this is what I identify with. So this is me. Okay. So that's something that is really critical to check into. And the other piece of it is, that is such a brilliant slide, Marty, that you had on before. I just took a picture of it. And those are all the things. They're free, they're available, doesn't require a prescription, doesn't require a penny. And it's also the things that people most likely tend to put on the bottom of their toolbox. And honestly, those things need to be at the top of the toolbox. Grounding, using the sun. I was just thinking another future topic would be great to talk about grounding. Why? What does it do? It actually literally changes the electrical charge of your cells. Okay, so this is really critical. So that's not a foo-foo slide. That's not a foo-foo suggestion. It's really, really critical to get out there. And what Marty said too, the science shows us actually when you're petting an animal, your blood pressure goes down, your heart rate goes down. For animal, they're so empathic. They're probably taking all your garbage, but whatever. They're very forgiving. But I just wanted to emphasize that. I didn't want to just hop over that slide of like, oh, those are cute little lifestyle changes. Those are actually critical lifestyle changes for living, for creating more life in your life. So that's my soapbox.
Thank you, Jen. And I forgot to put sunlight on here, so I'm going to add sunlight. It is there in the picture, in the one image, but I'm going to add that because getting out in the sun is very good for healing and for pain relief. So thank you for reminding me of that. Okay, also, I loved how you said, make sure you don't identify with pain. For some people, being ill is their identity. And I'm going to talk about that a little bit here as we move forward. Okay, emotional pain management and support. So fact, and this is documented, most physical pain and ailments have emotional roots. And by percentage wise, it's like 75, 80%. And I'm not saying, you cut your arm off with a chop saw. No, but standard everyday illness, getting colds, flu, other, I'm not going to name names, but other autoimmune type conditions and stuff have emotional roots to them. So if you are dealing with something and you have tried everything, we talk to people all the time. Oh, I've tried everything. Nothing works to help relieve the pain. I'm never getting better. I would encourage you to consider if maybe it's emotional. And yes, there are some people that are going to deny that. They'll say, oh no, it's not emotional. I've handled all my emotional stuff. That's not the issue for me, right? Well, if you're still sick and you're not getting better, it's something is causing it. So I know we've heard, and I say this too, do the emotional work. So what does that mean? What does that look like? So I thought I would outline it here. So first up, recognize or admit that there may be an emotional component to your physical pain or illness. And emotional pain results from several sources, including trauma. So there's different types of trauma. Childhood, which can carry through your entire life, because when you're a child, you accept everything that is happened to you as fact, because before the age of like 8, 9, 10, you don't have the decision-making capabilities to question whether something is true or not. You just accept it as part of your life and that this is normal. So childhood trauma especially, and it can be all different forms of abuse, and it doesn't have to be physical abuse. It could be mental or emotional abuse as well, can have an impact. Adult trauma, and again, that's accidents, injury related to relationships, family stuff, or this is super interesting, it can be inherited or ancestral. You might have inherited something from your grandma or great grandpa that is stuck in you. It's like an emotional DNA type thing. Just like things that can be passed on, like your eye color, hair color, how tall you are, etc. Emotional things can get passed through as well. Okay, next, PTSD from all different kinds of things. We especially see this from people that have been in the military or some other type of industry where there's violence, police force, things like that. But it can also be due to illness, abuse, or some other traumatic event, grief or sadness. And that can be not just the loss of a loved one, but also a pet, a home, relationship, job, a situation. That gets typically lodged in the lungs. So people are shocked to find that if they have breathing issues or have had respiratory situations for years or whatever, grief is many times at the bottom of that or connected to it. Anger, perceived injustice, betrayal, or insult. And we talked a little bit about this. Anger is tied with your liver. So if you are one that has liver issues, anger could be involved in that. And again, it might not even be yours. It may be inherited. Okay, next, and I'm hitting some of the big ones here. Of course, there are a lot of different emotional issues that can come up, but these are some of the main ones that I see. Feelings of being unworthy or worthless, or the I'm not good enough, I'm too old, I'm too young, no one loves me. Anything tied with our worth, or feelings like I have to be the good girl for anybody to love me, or I have to be act a certain way or they're going to leave me. So a lot of that is tied to false beliefs that we accrued during our younger formative years from age 0 to 10. And of course, this can come from parents, teachers, religious leaders, group leaders, or whatever, people that are in perceived authority positions. And another really big one that takes a toll on people's physical wellness is shame and guilt. And it can be from the same sources as above, or from something wrong that you did, but you didn't fix it. So I would encourage you, if you can still fix it, please, and apologize if you need to, because that is going to relieve, it's going to clear that energy, that trapped energy. Pain is trapped energy that wasn't processed. Okay. Here you go. We're continuing on this same topic of how to do the emotional work. So let's say you identify, wow, I do really feel worthless. I don't know where that came from. And a lot of times maybe you don't. But if it's resonating with you, I encourage you to process it, feel the feeling. Trapped emotions are just unprocessed at the time whatever event occurred. And an event can be somebody said something to you. I'll give you an example, like when you're in school and you're trying to learn something new. Let's say you want to be an artist, or you want to learn how to paint, and a teacher says something like, oh, you're not very artistic, maybe you should stick to reading books, or you're not good at this, you're not good at sports. When you're a kid, you take that to be truth. So I recently, within the last few years, dealt with a situation like that I just accepted that, oh, I'm not like this because of whatever. And it went back to a situation where I was actually 8 years old and comparing myself to another family member that was way better at something than I was. So I had this false belief for all these years, and it impacted so many parts of my life. So once you identify it, feel the feeling, give it its 15 seconds of fame, maybe it's 15 minutes, right? Validate the feeling. If you're feeling something, it's valid. It's okay. Then you can tell yourself, you know what, I feel that, but I'm choosing to release that. It no longer serves me. And you can ask it, please move on. I recognize you, I see you, but I don't need you anymore. So thank you. It's time for you to go. Challenge the feeling. Asking for proof. Is it true? So, let's just continue with worthless. Is it really true that I am worthless? Well, logically, no, right? You might feel like it, but is it actually true? No, it's not. Is there any proof that you are worthless? No, there isn't any. Okay, so that's when you challenge it. You say, okay, well, I've felt this, or I've carried this with me for X amount of years, whatever, but I'm choosing to release it. It no longer serves me. Okay. If, on the other hand, if there is a feeling and it actually is true, again, acknowledge it, give it its 15 seconds of fame, resolve it if possible. And even if it's not, put it in a box. I love this. I share this with my clients. Imagine, if you will, a large box, and let's say it's labeled feelings from when I was a kid, or things that happened in the past that I cannot fix. And if that feeling is somehow attached to that event, I want you to mentally picture yourself taking that feeling or that thing, throwing it in the box, putting a lid on, and then sending it up the conveyor belt. Okay, so if you have an image of that, that helps create separation from the emotional charge of whatever it is. And sometimes maybe you have a bunch of boxes. I got quite a few boxes of things that I cannot fix, or things that I lived through in the past. but I'm not letting them affect me emotionally as much. It may never go away, but you can take the charge way, way down. And all of these negative emotional things specifically impact pain as well. So that's one thing you can do. Here's some other suggestions. Journaling, write it out, take it outside and burn it. That is super powerful. And there are different things you can watch on YouTube as far as how do you release regret, resentment, things like that. And sometimes you just need to write it out, take it outside, burn it. Okay, that creates some finality to it. Crying it out. Crying is super powerful for your body because that's how it releases trapped energy as well. We've been taught in this country, Western culture, that, you know, just suck it up. What are you crying about? Or when you're a kid, you know, stop crying or I'm going to give you something to cry about. Probably most of us can relate to that, right? But crying it helps you release that, process it. Also, when you're crying it out, consider you taking some deep breaths, using oils, getting grounded while you're doing it. And I mentioned this a few shows ago. When little kids are crying or having a tantrum and then they do the, you know, the where they're inhaling really quickly, you know, like trying to catch their breath, that's your nervous system actually trying to trigger to calm it down, your parasympathetic nervous system. Okay, so that's a way for your body to help process it and calm you down. And so that's okay. Recognize it for what it is. Another great suggestion is talking it out to a trusted friend, counselor, therapist, or a professional. If you need professional help, go get it. Okay, but I'm going to suggest that you don't constantly relive it or dwell on it. Every time you do that, it's like you're triggering it again. And then I'm going to talk about some things that can help you not dwell on it here, right? Meditation, prayer, walking in nature, getting quiet, asking for help, and listening for guidance. Listen to your intuition. If you get quiet, and for those of you, if you haven't tried meditation or, you know, if it's something that maybe is uncomfortable or just because you haven't tried it and you don't know how to do it, I would suggest search on YouTube. There are some guided meditations that are really, really good and calming and for releasing pain and working through emotional issues as well. That's something that I have done that's been really helpful. Also, just getting quiet with yourself and putting, you know, a hand over your heart and one over your stomach and getting quiet and just saying, what do I need to know? What do I need to feel safe today? What can I release? Questions like that, and then be quiet and listen for the answers. You're going to get some information that's going to be really helpful to you, right? I mean, it's been helpful for me and millions of other people. So give it a try if you haven't done that. Okay, another thing that's really helpful is what's called tapping. It's also known as EFT, emotional freedom technique. Maybe you've seen it where people are tapping here. There's some certain points that you tap and you say things, I choose to release this anxiety. I choose to release this. I choose to release it. So they're tapping on certain acupuncture points, much like we use the patches on certain acupressure points or acupuncture points. It's because that's where a lot of the nerve endings are tied together in the channels. So EFT, you can learn about that again on YouTube. That's a really powerful tool to help you with emotional pain, releasing that. Okay, essential oils. I talked about forgive over the liver. That's a really good one. Console is like a hug in a bottle for anybody that's dealing with grief or loss of some sort. Console over your heart, on your wrists, behind your ears. Think of pulse points. That's a great place to use essential oils that are going to help you for releasing the emotional stuff. Okay, patches, X39 and Aeon. Aeon's the Happy Patch. Yes, this really works. And I was telling Jen yesterday, because I'm on vacation here in Oregon, and I ran out of Aeon and I had to order some and FedEx it in. And I was literally, I could feel the cortisol. coming back, sneaking back up. I love Aeon because it helps control the cortisol, which is directly linked to anxiety, nervousness, etc. So the patches really work as far as helping you feel happy, waking up happy. And today, I got my patches yesterday, put the Aeon on right away, woke up this morning, much better. So patches help with emotional stuff. Okay, point 8 there, emotion code, body code. That's the kind of work that I do. It releases trapped energies and emotions without you having to relive the trauma or the event. And I encourage all my clients, get the book, The Emotion Code, learn to do it for yourself. If you need help with that, that's what I do. I'm a certified emotion code, body code, and belief code practitioner. I'm happy to help you. You just go to my website and you can schedule a time with me. And I work in person in Placerville, but I also do sessions on Zoom over the phone, or I have clients that say, just work on me and email me the results. Yes, it works. It's quantum healing. It's energy. But that's for another time. We can discuss that. Okay. There. That's what I just said. If you want to work with me, you can go to my website, indigomartini.com, scheduling a body code or belief code. And typically people say, well, how many sessions do I need? I'm going to say one is usually not enough, especially if you're dealing with deeper issues. Some people just feel out of sorts and they're like, I don't have anything specific I want to work on. Let's just do a general session and see what comes up. And usually they're really surprised. Okay. But I'm here to help you with that. So I suggest usually 2 to 3 sessions to help resolve specific issues. Sometimes it's going to take longer. Okay. Everybody heals differently. So I thought I would put this in here. I talked to Jen about it. It's usually best to clear the emotional blocks or faulty beliefs before working with Jen to get the underlying physical issues, if you're open to that. Jen identifies them also, which you may be surprised because her and I work together in sessions where we kind of tag team. We did special sessions, 45 minutes, where I did the body code on somebody and Jen does her time waiver scan, and the same things would come up, and she can identify emotional things as well with her practice. So clearing the negative emotional energy clears the path for physical healing. And we touched on this a little bit. Illness can be part of your identity. You know, oh, I've always had MS, or my family has cancer from years ago, so I'm going to have cancer too. False beliefs about yourself is what you need to clear. Clear the chaos clutter first, then move on to the deep cellular healing. And that is what I love about what Jen does. She reads your DNA frequency. She digs deep to get what's really going on so you can fix it and follow her instructions and feel better. Okay, I am done talking. Sorry that went longer than expected, guys. Any questions or anything, Jen, we need to address?
I don't think so. I answered some questions or some comments in the chat, and that was really excellent. And I'm really happy you went this direction with this, because we need to normalize the fact that we can look at our emotions connected to our diseases and in pain that we experience, you know, in our culture, and pulling that all together. That's the ultimate holistic approach. And I'm really glad you tied all of that in, because that's the thing, that's the elephant in the room. So if I have someone that I've worked with several times and we're working through physical symptoms and they're just stuck, you know, it can be because there's an emotional connection there. I mean, for example, I have someone who has a very high candida level in their body and it will not clear with all the usual things, and finally had to just boil right down and say, tell me about the relationship with your mother. Okay. Candida has a lot to do with mother energy. So we get to go, you know, a little woo woo for people like that, but it's true. And they'll go, oh yeah, you nailed it on the head. This is about it. And then once that can be released from the body, Forgive is a wonderful essential oil blend that doTERRA has. And you mentioned that, for releasing that energy that's trapped in the body, for, you know, that connective energy there, if it has to do with a poor relationship, you know, with your mother or something in the past. Everybody has a mama wound. Every mama creates a mama wound. It's just kind of a thing. So anyway, so thanks for touching on all of that. That was awesome.
Of course. Thank you. I'm going to stop the recording here.